with the CPX-351, the toxicity profile is similar to the 3+7 in a way. So those patients obviously will have the myelosuppression, sequelae of myelosuppression, mainly infections like febrile neutropenias. The rate of those infections and the complications were not higher than the 3+7. The things peculiar about the CPX-351, as I mentioned earlier, the mortality actually was less at day 30 and day 60, keeping in mind that some of those patients, or almost 1/3 of the patients, were above age of 70 on those trials. The peculiar toxicities are probably patients will have like more distinguished rash that we see with the CPX-351. It's more common to see the rash than we see with the cytarabine. And there is some delayed recovery of the count. So there is almost a week or two more time for the count recovery than the 3+7. So one has to keep that in mind. That's sometimes also important in assessing the efficacy, because within that time, patients will not be called complete remission if their counts did not recover. In terms of other side effects, similar to 3+7, actually less hair loss with the CPX-351. I think the most important one is really the delayed recovery. In most patients, it's a week or two more than expected with the 3+7 chemotherapy. So the average is going to be 30 to 40 days to recover the counts. There is a very, very small subset of patients that had more delayed recovery with the CPX-351. Many times when we dig in those cases, we find that those patients actually had persistent disease rather than treatment, but it is expected with the liposomal packaging of the drug that the effect is longer. So one has to anticipate that delayed recovery. And that also could set the timing for the consolidation, which is the next step of treatment for those patients.